Hi, everyone. You're hearing my voice. This is Diane Weichel. I'm a Knowledge Translation Specialist at the NCC for Determinants of Health, and I am sitting in Antigonish, Nova Scotia. Behind the scenes is Asher Cortete, and she is our Knowledge Translation Coordinator, sitting in her home office in Montreal. As you know, we are one of 6 NCCs for Public Health. We are the East Coast, the most East Coast of the NCCs. And if you would like more information, we are at NCCDH.ca. And most importantly, before I go any further, I want to acknowledge that the NCC for Determinants of Health is, we're located at St. Francis Xavier University, and that institution is located in Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by treaties of peace and friendship in which Mi'kmaq and Molistokek peoples first signed with the British Crown in 1725. Those treaties did not deal with the surrender of lands and resources, but they recognized Mi'kmaq and Molistokek title and established the rules for what was to be an ongoing relationship between nations. This is a bit about the NCC for Determinants of Health. Our website is nccdh.ca. Please come and visit us and let us know if you have questions or want more information. So before I get to our speakers, there are 2 pieces of information that came to me recently in recent days that I want to let you know about. This is an online course specific to addressing health equity and climate change. It opened yesterday, and so it is, I forget the exact days, it was February 18th to sometime in April, I believe, that the online course is open. It is available en français seulement, so only in French. However, there are lots and lots of fantastic resources. It is directly applicable to the subject that we're talking about today, and I really strongly encourage that you go and look up this resource. And as well, I want to share some information that was shared by our friends Jeff Masuda, Diana Lewis, and Blake Pulland. And it's all very timely, this subject of climate change and health equity and public health. This is a call for papers that the Canadian Journal of Public Health has put out just recently. They're asking for manuscript submissions on the topic of climate change, public health, what the role of public health is, and in particular, we really want to hear about that impact on health equity. So there's Jeff Masuda's email at the bottom. You can connect with him directly if you're interested in participating, want some more information, and this is a great, great resource to contribute to, and please feel free to share it far and wide within Canada and outside of Canada as well. And with that, I am largely going to, you're not going to hear my voice very much anymore. We have 3 speakers today. I will introduce the first speaker, and then Monika will introduce the other 2. So we do have 3, Monika Dutt, Linda Rudolph, and Helen Doyle. And with that, I am going to say a few words about Monika. Monika Dutt is the Medical Officer of Health and CEO at Temiskaming Health Unit. She holds a Master's of Public Health and a Master of Business Administration from Johns Hopkins University. She's past chair of Canadian Doctors for Medicare. She's a former medical officer of health in Nova Scotia and in Saskatchewan. And she also worked as executive director for the organization called Upstream. She's worked in public health and family physician in Northern Canada and Toronto, as well as in India. She's got policy interests in healthcare, income inequality, poverty, climate change. She is a really big advocate for social justice issues and public health. And she's representing us, or today, she's not representing us, she's with us representing the alPHa-OPHA Health Equity Work Group. And that's what she's going to tell us about. So over to you, Monika, and then I'll let you introduce our other speakers.